Thank you and New Year's greetings to everybody. We are really sorry we are delayed, and it gives me immense pleasure to welcome you all to this evening's CME program on tinnitus. Today we have honored by the presence of Dr. Vinod Khandelwal, who is on the way, coming up, and he is from Ahmedabad. We will talk on management of tinnitus, focusing on a promising drug, Caraverin. And unfortunately, Dr. Anirban Vishwas is not with us today. He has to leave for some sudden work to Malaysia, and he has already sent his talk or presentation, and that I request Dr. Surajit Burman to present on behalf of Dr. Anirban Vishwas.
Second of all, Dr. Anirban Vishwas sir has also said that he is extremely sorry that he could not come today. But he has been magnanimous enough to send his slides and has given me the honor of presenting them. So, today, but the current treatment do not have much better results. Now, this is an alphabetical listing of all the treatment modalities or treatment attempts that have been made to medical treatments. And we have some utter quackery. Even you will see in this treatment there is moose poo, pigeon poo and whatnot used to try and treat out tinnitus. Now the available treatment modalities. The most commonly used is TRT or tinnitus retraining therapy. Number 2 is masking. Then we have drugs. We have trazodone, lidocaine, tokenide, and of course Caraverin. Then herbal medications like ginkgo biloba, mineral supplements, transtympanic medications, steroids, gentamicins, psychotherapy, behavioral therapy, noise generators, tinnitus treating instruments like neuronomics, tinnitus phase-out therapy or TPOT, and even anxiolytics and sleeping pills. Induce habituation. No effective ways to abolish tinnitus or even reduce the intensity of the tinnitus. And the goal of the treatment is to abolish or suppress tinnitus and reduce the volume of the tinnitus. Now, mechanism related to behavioral emotional problem in tinnitus. Main problem of tinnitus sufferer is a psychic or mental manifestation and not so much the sound. Tinnitus, if limited to the auditory system, causes no behavioral problems. 80% subjects perceiving tinnitus have no behavioral emotional problems. Character, that is intensity, pitch of tinnitus has no link. Basically, the tinnitus induces the limbic system, which when stimulated releases stress hormones. There is use of the background sound, amplified sounds from hearing aid, benign nature explained. Psychotherapy for management of stress and relaxation techniques by a psychologist, and sometimes treatment of psychiatric disorders like depression, anxiety and schizophrenia by a psychiatrist. Now the objective of a use of a noise generator is to reduce the contrast between the tinnitus and ambient noise. Thus habituation of the tinnitus is reached. By reducing the contrast between environmental noise and the tinnitus, the patient feels a comparatively much fainter tinnitus to which she gets habituated easily. So this can be done with the use of sound from hearing aids, environmental sound, noise and music. Next comes music therapy. Now for many tinnitus sufferers, listening to background music represents a more acceptable, even pleasant alternative to background sound. Almost 50% of tinnitus patients sampled listen to music to help with their tinnitus. Music can be used for total or partial masking. your skin temperature and the relaxation is reduced, and there is release of hormones to reduce the stress. So some types of music has been shown to provide mental relaxation, but not all musics. So music with fast tempo or sudden changes in rhythm, loudness and high pitch produces a state of alertness that is detrimental to tinnitus. So no rock music or rap music. Soft, slow music produces soothing effect and a state of relaxation. Selected music reduces stress and breaks the vicious cycle of stress and tinnitus, each perpetuating the other. Some high-end digital hearing aid now have special music programs to help mental relaxation. A survey conducted by the New York Times in 2000 showed that 64% of the general population listened to music to relax, and 8% participated in the meditation or yoga classes for relaxation. The incidence of increased stress is reportedly higher in people with a hearing loss than the normal hearing population. Processing of music is conducted in the Herschel's gyrus of the auditory cortex and the limbic system. Herschel's gyrus has been found to be larger in musicians compared to non-musicians. Parts of the limbic systems that have shown activities to music stimulation include the amygdala, the hypothalamus, and the prefrontal cortex. Changes in a person's mood and emotion while listening to music have been linked to physiological changes in heart rate and respiratory rate. The slow music that play in random, the volume, tempo, and pitch can be individually adjusted. Music programs can be played with or without the microphone. In patients with, now this is important, patients with bilateral hearing loss but only unilateral tinnitus, music is to be played bilaterally to alleviate the tinnitus annoyance. As for music, music selected for the purpose of relaxation shares some common characteristics. A tempo at or below the resting heart rate, that is 60 to 72 beats per minute. Predictable dynamics, that is soft to moderate loud. Fluid melodic movement, pleasing harmonics, regular rhythm without sudden changes. Tonal qualities that include the flute, strings or piano, sounds of the voice, organ, and applying music for relaxation is to make the music aesthetically pleasing and relaxing to the listener for as long as it is required. Unfortunately, the same piece of music could lose its novelty and effectiveness after repeated listening. Indeed, music presented over time creates expectation of what is to come, and this influences the listener's emotional reactions to the music. To overcome the dilemma of decreasing novelty of a musical stimulus over time, one may generate music that never repeats itself completely. This can be done using fractals. Now, what is a fractal? A fractal is a fragmented geometric shape that can be split into parts, each of which is at least approximately a reduced size copy of the whole. A property called self-similarity is generated by specific mathematical formulae. Hence, fractal music can be continued forever without necessarily repeating the same sequence of notes while maintaining the desired novelty. Since fractal music is generated with mathematical questions, it can be conveniently implemented in a digital signal processing DSP hearing aid. Modern hearing aids have built-in programs. Example, Gen in Widex H, to generate the fractal music tones in a manner that is not predictable or monotonous but has all characters for relaxation. Now, Widex Music's program, this is thus given as an example. This program generates sine-like music based on a patented fractal algorithm. There are 3 steps in music generation. A random number sequence is generated by the fractal generator. These numbers are assigned a pitch, tempo and intensity based on predefined rules. As many as 12
because of which I got a chance to share my experience about use of carotid. Not use of carotid in fact, but a clinical trial which I conducted in 2002. Like when we see a title or somebody says about tinnitus, one single dose of carotid, one single dose of some medicine. If you give intravenously, and you can give a cure in tinnitus. So the way I'm sure every one of you must have a question in mind. There's something must still be issued. How once tinnitus is years together can have a cure with a one injection. So similarly, I also had questions when I came to know about it somewhere in 2000 and 2001. Professor Klaus Edelberg at University of Vienna, Austria, he proposed some hypothesis of explaining the mechanism of cochlear synaptic tinnitus. Based on that hypothesis, he conducted an animal trial. He published a proof of animal trials as a proof of his concept. And based on that concept, he thought of certain medicines, and out of which he came out with a drug, carotid, a molecule carotid, which is supposed to be the most effective drug. And after going through detail of it and various international publications by him, I was convinced. So today I'm here to tell you on what ground this drug came, what was the proof, how it arrived and how it really works. Not only Kerorin, simultaneously I'm going to tell you about ASA or management of tinnitus, because of which I'm sure all of you will also agree at the end that a tough symptom which was giving frustration not only to patients, to ENT surgeons also, to treat these symptoms. But today in my clinic I'm able to provide benefit to about 90% of the patients. So tinnitus, but this august audience, I don't need to tell about classification and everything much in detail or tell about the tinnitus. But these are the various symptoms which patient tells, and we know that depending on which area of the hair cells are damaged, different descriptions could be there by patients. But for us, it is a sound in the patient which patient hears, which is not existing in the surrounding, and it may or may not disturb sleep, or it may or may not disturb hearing. To understand it in a better way, easy classification. We are not concerned here with objective tinnitus. If we classify subjective tinnitus, it can be classified in auditory tinnitus and non-auditory tinnitus. These are very rare conditions, non-auditory tinnitus, gaze-evoked tinnitus. When a patient looks to one particular gaze, he hears a ringing sound in the ear. And a paper was published in this span of 22 years. I came across about 2 such cases. Cutaneous evoked tinnitus, when patient scratches one particular area of a skin and he hears a tinnitus sound. But these are rare conditions and we are not much concerned. But we are concerned with the auditory tinnitus, myogenic tinnitus. All of you know it's because of a tonic and clonic spasm, flickering of a muscles of middle ear. The patient hears the sound. So it's a middle ear origin. Cochlear synaptic tinnitus, which is because of a pathology in the cochlea. And it's a out of tinnitus cases, the highest incidences are of because of a cochlear synaptic tinnitus and retrocochlear tinnitus. Here mismatch of percentages because of some patients are having a cochlear as well as retrocochlear both, and that is how this is classified. Now mechanism. Professor Klaus Edinburgh, he tried to explain origin of a cochlear synaptic tinnitus, which was based on a 3 facts, and there are 3 receptor subtypes which I think this light diminishes the user, so not even. And this is a basic concept based on these are the basic facts which are proven facts, and based on this concept was given by Professor Klaus Edinburgh to explain mechanism of tinnitus. When sound reaches to the inner ear, a basilar membrane, outer hair cells and tectorial membrane, it does the shorting of frequency and intensity of the sound, and it passes this information to the inner hair cells, and this information based on a type of a sound is passed to the inner hair cells. And inner hair cells, in response to sound, a corresponding amount of glutamate granules are released from our inner hair cells. Inner hair cells, and these glutamate granules, it crosses the synapse and reaches to the receptors on a postsynaptic membrane. These glutamate granules, in a physiological state, it comes in contact with these receptors and it generates a specific interplay between this, and because of that, the specific type of depolarization is generated in a postsynaptic cell. And this impulse, it goes to brain and patient hears the sound. Now, in a pathological condition, now in a normal physiological condition, when this glutamate receptor comes in contact with the receptors, it stimulates and immediately gets dislodged from that receptors, and that receptor is now ready for receiving next stimulus. But in a pathological condition, because of a damage to the inner hair cells, because of several reasons which I'll tell you just now, this glutamate which is released in response to sound stimulus is either in excess or is in a toxic form, and this toxic glutamate granule has got a very strong affinity for a postsynaptic receptors. So when toxic glutamate granules comes in contact with the postsynaptic receptors, it stimulates and generates a disturbed interplay between these receptors in such a way that it generates a state of a spontaneous depolarization state, meaning by continuously, and that toxic glutamate granules remains adherent to the post-synaptic receptors. It remains there. Instead of getting detached, it remains adherent to them because of its high affinity to these receptors. And this is a basic concept, so that a spontaneous depolarization state is generated and a patient continuously hears a one monotonous sound. And this is how tinnitus happens. So, what are the causes of inner hair cell damage? So, all of us knows that because of a noise exposure, local or general circulatory disturbances resulting in a ischemic condition, metabolic disorders of a generalized diseases of a body producing some toxins comes in a circulation may damage hair cells. Inflammatory reactions of a middle ear, particularly of a viral origin, traumatic conditions, hypoxic conditions, aging process, and this is a free radical theory which is accepted worldwide. That during, particularly because of a polluted air inhalation, the respiratory metabolism of a particularly in a mitochondria, carbohydrate, fat, and a protein metabolism are disturbed. Where because of that polluted air, free radicals are generated during that disturbed metabolism, which comes in a circulation, and these free radicals are such atoms which has got a highly reactive reactive deficit electrons in these molecules, and when these free radicals are in the circulations, they pick up deficit electrons from a normal cells of the body, and wherever it picks up the cells, that cells gets damaged. This is a concept of a free radical, and that is a reason today all over the world people started and this mechanism is responsible for aging also, and that's why all over the world people started prescribing antioxidant drug which provides deficit electron for this free radical, and this is one of the major cause of a damage to the inner hair cells. And so these are various causes by which inner hair cells are damaged, and when inner hair cells are damaged, toxic glutamate granules are produced, and which results in a spontaneous depolarization state of a post-synaptic receptors cell. This is just a simplified video to explain this mechanism as a whole. Because of a stronger affinity, it forcefully dislodges the toxic glutamate granules, which is adherent to the post-synaptic receptors. Toxic glutamate granules from post-synaptic receptors, and then it itself also gets dislodged from there. And so now these receptors are free for receiving new sound stimulus. And this is how it explains the mechanism, how our tinnitus since years together can have a benefit with a one single shot of injection. But there are those of a damage to the hair cell can be prevented. It is also calcium antagonist, so acts as a microvasodilator. It has got antagonist, as I explained, antagonist to the different glutamate receptor subtype. It also acts as a scavenger for a radical oxygen species, and it also acts as a potential repellent. Various publications are published, so you can refer this in detail, which shows a proof of animal study, proof of concepts, and everything. Now, but looking to this concept, this drug should work very well, but a word of caution is very important here. It is indicated only in case of a cochlear synaptic tinnitus. So diagnosis of a cochlear synaptic tinnitus is very important. One. Second, overdose may increase, even though it is temporary, but it may increase tinnitus temporarily. So to avoid these two things, it is necessary to understand perfect diagnosis of a cochlear synaptic tinnitus and how to use this drug. For diagnosis, this is now very important to understand. Like audiometry, we all are bass volume, etc., and few others. And impedance audiometry, this is important to prove, to check no time. It again gives a new damage, and a tinnitus again reappears immediately. And so, before you push Carol, it is necessary to check the middle ear status, and it should be normal. Similarly, now all the impedance audiometry machines are available, where facilities of our usage and tube function test are easily available, and easily you can do by automatic testing. A clinching reflex test, because this is not mentioned in our book. Clinching reflex, while checking for an acoustic reflex, keeping a probe in the ear, check the acoustic reflex, particularly in a low frequency, 500 and 1000 Hz, acoustic reflex is present. Then keeping the probe in situation, ask patient to do a clinching and reach record the acoustic reflex in lower frequencies. And if there is a deepening found, unless proved otherwise, it is a middle ear origin. If middle ear muscles are at fault, and if a tinnitus of a middle ear origin, then clinching reflex will be strongly positive. And this is very important test, because later on I'll tell you that when you treat patient of tinnitus, middle ear tinnitus or middle ear origin, it is 4 to 5% of our patients of a tinnitus, where in a resistant conditions, we also operate that patients by cutting the inserting belly. While you are going to do some surgical step, then it is necessary to have a documentation of its cause. So this is a very important document to prove that this is a, every one of us know that a BK is positive, it's a retrocochlear pathology. Then you grade it as a 10. If your tinnitus is 0, so there is no tinnitus, you grade it 0. And based on this comparison, now grade your tinnitus, where you will put your tinnitus. Let him grade on his own. And after little gentle explanation, all patients are able to grade their own tinnitus. Whatever they grade, if they grade a 7, 8, 9, that is fine. Then when we start injecting, we ask them that now if suppose he grade it as an 8 and we start pushing caravari, we ask them that if it is reducing, go telling us that it is reaching to the 7, 6, 5 like that. And when it reaches between 2 to 1, we stop pushing more caravari to avoid overdose. Because for a residual tinnitus, there are certain other methods. If still persists, you can give a second dose, but we want to avoid overdose, and that is the main purpose. So this gradation system is, and in our clinical study, we considered responder as those who had a more than 3 grade benefit. We had considered them as a responder, and that is, this is how caroline is to be used. And based on the decided selection criteria like inclusion criteria and exclusion criteria for the purpose of including only patients of a cochlear selective tinnitus. And we insisted all the patients to avoid autotoxic drugs, tranquilizers, sedatives, hypnotics, muscle relaxants, antihistaminics and levethyl sedatives before 7 days. But these were for the study because we wanted to check the effect of caravari. This is not a contraindication. If patient may be with this, but in that case, you may not be sure that this drug acted or caravari acted. If you want to check about caravari, then this drug should be avoided. And we collected the data prior to infusion, immediately after infusion, 1 week after infusion, 4 weeks after infusion. Now we have little longer data also. And in all patients, what we checked, grading and matching of tinnitus, we also checked for audiometry. Because we at that time we were not knowing whether this drug is affecting hearing level or not. So in all the patients we were checking for audiometry and any other side effects. And the question comes here, why these 39% are not responding? So the explanation for this 39% not responder, like there is an excess toxic glutamate. Those who were responder remained as a responder. No serious side effects were found, and it explains the hypothesis which explained. Results are consistent with other published clinical trials. There are few trials published which are about use of caravari injection. About more than 2 lakh ampules are used till date in European countries, and the results were published in certain journals. And results are almost similar as the results of our study, and no real relation with the demographic data is found. So today, with such an effective drug, we can say that there is no need to say sorry, and you will have to patients that you will have to live it. Believe me, in this 22-year of span of practice, I came across about 8 patients who did suicidal attempt only because Authority of India gave permission for a certain number of patients and use of a certain number of ampules. It was a double-blind study. But fortunately, because of that, large number of patients started coming to us, and I was not able to utilize after that caravari injections, and so I got a chance to use the hearing loss. That hearing aid is the best solution to it. Hearing aid always masks low frequency sounds very well. High frequency it may or may not, and it is found that always low frequency sounds are very well masked. If this patient is with hearing loss, we want to improve hearing also, and so hearing aid is the best solution to it. But with a normal hearing, then tinnitus masking tinnitus maskers, professional maskers are available in the form of TCI, BCI, combi. But in our experience, tinnitus retraining therapy works very well. Tinnitus retraining therapy, audiologists, I am sure they know it very well. Where patient in a soundproof room, a sub-threshold level, after finding out its intensity, give a tinnitus retraining therapy, and it is found in our study that the tinnitus-free period is gradually increasing in most of the patients, and patients are very happy. So, with a normal hearing, tinnitus retraining therapy is important. But for a resistant cases, cutting of tensor tympani muscle gives really good results. And whenever we try in the resistant cases, it gives really good results. But before that, one should check middle ear functions. And covering is specifically effective only on a 3 receptor subtype only, which is present only in the cochlea. And these receptor subtypes on a post-synaptic membrane are not present anywhere in the brain. So it is safe. Second, since last 50 years, the drug is used in an injectable form all over the European market. So injectable drug and a long-term duration. This is a base on which Indian Drug Control Authority of India they give permission of this drug about safety. And in a sudden onset of sensorineural dose, right now the dose which we are using is a 4 ampule. 4 ampule in a pint in a concentrated, more concentrated form in a 24 hour span. So very large dose we are using, and then also it is safe. So for a tinnitus single dose in a very diluted form, there is no possibility of any side effect or any reaction. Few other possible cause of, but if you remember, if you just think retrospectively, all of your patients, which patients comes to us for a tinnitus complaint? Those with a monotonous sound what they hear. So once some trauma occurred, like a sudden exposure of a noise, some injection like chloroquine, quinine used, the phototoxic drug is one trauma, which gives a one trauma to the post-synaptic receptors. These are the patients where single time trauma which precipitated tinnitus, and now there is no more similar trauma, and so this patient gets very to the carovoid. But as I said, a middle ear pathology is there, viral inflammation, secretory otitis media is still there, a chemical perfusion through round membrane is still there, and if you try to push carovoid, I'm sorry, it is not going to happen. Statistical analyses are to be done because it's a double-blind, placebo-controlled trial study. So to tell anything right now, I think I'm wrong.
No, what I mean is that basically,
in some certain limits, I'm sorry. I was not about outside.
What is the age group?
In a clinical trial, we restricted 16 to 620 patients. Now we have about 800 patients with us. And almost similar data are there. As in our country, follow-ups are comparatively big, but even though in our center we try to manage so many things systematically, that we are following a lot of patients.
how the
Hypnotherapy is there. We tried even in presence of 300 ENT surgeons also we tried in few patients. But as I said, many, I think I forgot the name of the doctor, he presented a long list of various modalities of treatment. Any treatment you use, no treatment, unfortunately no treatment is consistent. That's why the importance of carovoiding is there. Whatever data we say are still in a various multi-clinical trial, multi-centric trial and multi-country trial. The results are consistent almost in a near, like in my result it's 61%, somewhere it is 55, somewhere it is 64, like that. So it is in the same range, results are consistent. Otherwise any modalities of treatment, like hypnotherapy, sometimes some person says, I give result to 2 per person. I give 4 per person and no results was there. So consistency is not there in any other modalities of treatment. Sir, is carovoid for going through the procedure. We started the procedure. I was also insisting on saying that why, if it is so important, and even in Europe and USA, tinnitus, as the guy said, tinnitus clubs are there, and many patients of tinnitus are there. Why don't try that? But it's a very long and very tough process. They say even in India it took 8 years after a successful clinical trial. So it's very costly, and that's why we are still not going ahead on it. So there is no other reason about it. In fact, today, because of their website, patients, at least Indian patients from US and UK, they come to our clinic for a treatment for tinnitus.
Since you have a long
Subject that it was frustrating for patients and for us too. But fortunately now we are able to manage. And I'm sure after going through this methodology of a treatment, and I think I tried to clear and made it easy. The concept of treating tinnitus is easy. So now I think there is no need to avoid patients of tinnitus. Instead of that, if you systematically approach, you'll be able to give a lot of benefit to patients.
Out of calories,
But patient comes and there is a specific treatment. Every one of us knows. The objective tinnitus has a base on a cause. There is a different treatment. These people cost.
Used around all over India 500 injections. Out of that 300 injections, since 300 patient has responded. Now the response may be of 25%, 50%, 60% or 100%. But those people has responded to the tinnitus. And we always update our website, which is www.tinnitus.in, where we update everything which is coming, and it is every day it is updated. Something new is coming. Every day we update about what the tinnitus patient right now is pool of tinnitus patient has been, what is the response of those tinnitus patients, how many clinics and how many doctors are using it, what their response is. If there is no response, we write no response from this doctor for these patients. We write the patients taking their concern, their patient's address, phone numbers, doctor's phone numbers, clinic, everything is on the website www.tinnitus.in. And apart from that, I want to give one more thing about is that
I have seen that there is a paper, a second paper, that is physiological reconstruction of the ossicular strain by the same speaker. I think we should close this session. It's a very good subject you have taken for study, and in this part of our country, we will try. Lot of our new doctors are interested, and I think they will be coming up and they will request you to help them. I have seen that this study is mostly subjective. I mean, this test, the result is subjective. You can find out the result on the spot, and that is the essence of the study. Thank you very much. Organizers, I know.
Ossicle-like consistency within 3 to 6 minutes. So only required is a between processes and bone also it gives an excellent adhesions, and it provides a stable reconstructions. Now this light should be anti-inferior. If your cone of light is anti-inferior, unless put otherwise it is 55-degree angle. So creating a middle ear, the same material can be extended to the medullo-imperial area also.
We achieve joint mobility.
We don't achieve joint rotation movement is.
So it is not a total physiological reconstruction.
Near physiological. Whatever we are doing a reconstruction, we always sacrifice this. Important is the angle of a timbering membrane that we are achieving here, which we were never achieving in any other way. 2200 or 2400 rupees. We have to use that cartridge. But now, within short, with our efforts, we are coming with one Indian version which will cost around 1400 to 1500 rupees. Of a per operative audiogram, post operative audiogram at an interval of 3 months. We have large data on it, very large.
Anisha sir, to felicitate Dr. Khandar. I thank you all for coming right in.